You are a nurse at an oncology clinic taking care of a 65-year-old male with stage 1 non-small cell lung cancer, NSCLC, who is 1 year removed from a wedge resection and chemotherapy. Which of the following tests would be best to assess treatment response in this patient? A. CT, without PET. B. X-ray. C. Pulmonary function tests. D. PET, CT. E. MRI. The answer is D. PET, CT. PET, CT shows not only spatial information from the serial slices taken on CT imaging, which would include the size and location of any potential tumor, scarring, or nodal involvement, but also the FDG avidity or uptake of the contents of the image, which would help correlate the spatial findings with possible disease activity. Nodules observed on a CT scan can be nondescript, ranging from malignant, to indeterminate, to benign, which may still be infectious or inflammatory. The addition of PET to a CT allows the observer to see which nodules, nodes, or lesions are more likely to be indicative of disease burden, as tumors and infections will have greater FDG uptake since they are more metabolically active than surrounding tissues. MRI is not typically used to assess treatment in lung cancer, as CT coupled with PET is more commonly used. X-ray does not provide enough resolution to adequately assess response to cancer treatment. Pulmonary function tests, while a useful measure of lung functionality, do not give a specific picture of the lung cancer burden and as such are not the best treatment response assessment tool. You are the nurse in an oncology clinic taking care of a patient with a glioblastoma who has been receiving chemotherapy and radiation therapy. You want to assess response to treatment. Which of the following images would best assess treatment response? A. CT head without contrast. B. PET, CT. C. MRI head. D. X-ray head. E. CT head with contrast. The answer is C. MRI head. In evaluating brain parenchyma, which is relatively soft tissue, MRI provides the greatest degree of spatial resolution, which would best allow assessment of any residual, recurrent, or new tumor burden within the brain. CT imaging is commonly used to assess the brain when evaluating for bleeds or fractures, among other conditions, as it is far more expedient than MRI. However, it does not visualize the soft tissue of the brain parenchyma as well as MRI, and treatment response MRI scans are often not emergent, and therefore MRI would be preferred. PET, CT, while often highly useful in oncologic assessments, is of limited value in evaluating the brain for cancer response, because the entire brain is highly metabolically active in nearly all patients, and therefore the entire brain typically has a great deal of FDG uptake uniformly, limiting the value of the scan. A client had just undergone a total right knee replacement and has just returned from the operating room. Later that evening, the client suddenly begins to complain of shortness or breath and chest pain on inspiration. The nurse caring for this client further notes the coughing up of blood and that he is sweating profusely. Which of the following nursing interventions should the nurse perform first? A. Assess the client's mental status. B. Place in Fowler's position. C. Auscultate for breath sounds. D. Give oxygen. E. Draw blood for arterial blood gases, ABGs. The answer is B. Place in Fowler's position. The priority for this client is to ensure a patent airway by placing him the Fowler's or semi-upright seated position. Giving oxygen is warranted but will be given after the client is positioned correctly. ABGs would be helpful in this situation but is not the priority. Auscultation of breath sounds and assessment of mental status are not indicated. What is the final stage of a pertussis infection? A. The recovery phase. B. The convalescent stage. C. The post-infectious stage. D. The paroxysmal stage. The answer is B. The convalescent stage. The final stage of a pertussis infection is known as the convalescent phase. This occurs for 2 to 6 weeks, after the paroxysmal stage of the disease. During this time coughing decreases, and paroxysms are less severe. The infected individual may experience increased susceptibility to upper and lower respiratory conditions for as much as 6 months after resolution of the infection. Which of the following organisms causes whooping cough? A. Haemophilus influenzae. B. Bordetella pertussis. C. Human respiratory syncytial virus, RSV. D. Klebsiella pneumoniae. The answer is B. Bordetella pertussis. Whooping cough, a condition that results in severe paroxysmal coughing fits followed by a long wheezing inspiratory gasp, the whoop, is caused by the bacteria Bordetella pertussis. Haemophilus influenzae and Klebsiella pneumoniae both commonly cause pneumonia, and RSV is a virus that is frequently implicated in lower respiratory infections of infants and children.